Struggling to go? Feeling like you need a push, but nothing's happening? Don't worry, you're not alone. Constipation is a battle we all face at some point, but luckily, stool softeners are here to save the day. Welcome to HeInfo, your go-to source for health insights. In today's video, we're diving into stool softeners, what they are, how they work, and how to use them safely. Whether you're dealing with occasional constipation or just curious, we've got you covered. What is a stool softener? A stool softener is a type of laxative that helps relieve mild constipation by making stools easier to pass. Unlike stimulant laxatives, stool softeners don't force a bowel movement. Instead, they work by drawing water into the stool, preventing it from becoming hard and dry. This makes it easier to go to the bathroom without straining. Stool softener versus other laxatives. What's the difference? While a stool softener is a type of laxative, not all laxatives work the same way. Laxatives in general promote bowel movements, but different types target different causes of constipation. Some laxatives stimulate the intestines, while others add bulk or moisture to the stool. Stool softeners specifically help by increasing water content in the stool, making it softer and easier to pass. What does a stool softener do? A stool softener is ideal for short-term relief of occasional constipation. It is often recommended for people who need to avoid straining during bowel movements, such as those who have heart conditions, e.g., recent heart attack, recently given birth, hemorrhoids, undergone surgery or medical procedures. If you're experiencing constipation due to pregnancy, medication, or lifestyle factors, a stool softener may provide gentle, effective relief. Always consult a healthcare provider for the best option based on your needs. How do stool softeners work? A stool softener is a type of emollient or surfactant laxative that helps relieve constipation by allowing more water and fat to be absorbed into the stool. This makes it softer and easier to pass. The active ingredients in most stool softeners are docusate sodium and docusate calcium. Common brands include Colace. Types of stool softeners. There are different ways to take a stool softener, including oral stool softeners. These come in the form of tablets, capsules, or liquid syrups, which you take by mouth. Rectal stool softeners. Some stool softeners come as enemas that you inject into the rectum. They work similarly to stool softener suppositories, but instead of melting, the liquid is absorbed directly. Natural stool softeners. If you're dealing with mild constipation, you may want to try natural stool softeners before turning to medication. These lifestyle changes can help keep your digestion regular. Drink more water. Staying hydrated softens stools naturally. Exercise regularly. Physical activity stimulates bowel movements. Increase fiber intake. Eating more fruits, vegetables, and whole grains can improve digestion. Take a probiotic. Good gut bacteria can support healthy digestion. When is the best time to take a stool softener? The best time to take a stool softener is usually before bedtime. Always follow the instructions on the label or consult a healthcare provider for the correct dosage and timing. How to take a stool softener safely. A stool softener should only be taken when needed and exactly as directed. Avoid taking more or less than the recommended dose, as your specific medical condition determines the proper amount. If you experience diarrhea, stop taking the medication and contact your doctor if symptoms persist. Proper dosage and administration. Capsules and tablets. Swallow whole. Do not crush, chew, or split. Take with a full glass of water, 8 ounces or 240 milliliters, for best results. Liquid and syrup. Shake well before use. Use the provided measuring device, not a household spoon, for accurate dosing. Mix with milk, fruit juice, or formula, 4 to 8 ounces or 120 to 240 milliliters, to mask bitterness and prevent throat irritation. Enema, rectal use only. Wash hands before use. Remove the cap and gently insert the tip into the rectum. Squeeze the tube completely, then withdraw it while still compressed. Never take an enema by mouth. Important precautions. For children, Consult a pediatrician before giving a stool softener to a child, as they may require special dosing or alternative treatments. For colonoscopy prep, do not use stool softeners containing docusate for bowel preparation. Instead, ask your doctor about the best laxative for your procedure. Choosing the right laxative. There are many types of laxatives, and stool softeners may not be the best choice for your condition. Talk to your healthcare provider to find the right option for you. By following these guidelines, you can safely and effectively relieve constipation with stool softeners while minimizing risks. How long do stool softeners take to work? When taken as directed, a stool softener typically works within 12 to 72 hours. The exact timing depends on factors such as hydration, diet, and individual digestive health. Can you take stool softeners every day? No, stool softeners are not meant for long-term use. You should not take them for more than 1 week unless directed by your healthcare provider. If you experience sudden changes in bowel habits lasting over 2 weeks, persistent hard stools after 1 week of use, contact your doctor for further evaluation and alternative treatment options. Stool softener drug interactions. If you're taking other medications, consult your doctor before using a stool softener, as it may interact with certain drugs. Specifically, mineral oil may alter absorption and effectiveness. Phenolphthalein-containing drugs can interfere with stool softener function and increase side effects. Can you take stool softeners during pregnancy? Constipation affects up to 39% of pregnant people, but not all stool softeners are safe during pregnancy or breastfeeding. Speak with your healthcare provider before use, especially if you are pregnant or planning to become pregnant. Are breastfeeding. If you become pregnant while using a stool softener, consult your doctor immediately. Always weigh the benefits and risks with a medical professional before taking any laxative during pregnancy. Possible side effects of stool softeners. Most healthcare providers consider stool softeners safe for short-term use. If your doctor recommends one, they have determined that the benefits outweigh the risks. However, some people may experience mild or serious side effects. Common side effects. If side effects occur, they are usually mild and may include stomach pain or cramps, nausea, diarrhea, throat irritation from oral stool softeners. If these symptoms become severe or do not go away, contact your healthcare provider. Serious side effects. Seek medical help immediately. Although rare, some stool softeners may cause serious allergic reactions or complications. Call your doctor right away if you experience skin rash, itching or hives, swelling of the face, tongue or throat, dizziness or trouble breathing, difficulty swallowing, fever, rectal bleeding. If you notice any of these symptoms, stop taking the stool softener and seek immediate medical attention. Stool softeners for constipation relief. Constipation is a common issue caused by lifestyle factors, pregnancy, medications, or underlying health conditions. A stool softener is a type of laxative that provides short-term relief by making stools easier to pass. How to use stool softeners safely. Always follow the directions on the packaging. Do not use for more than 1 week without consulting your doctor. If constipation persists beyond 7 days, contact your healthcare provider for further evaluation and alternative treatments. Remember, stool softeners can help, but they're not a long-term fix. Always follow the instructions and talk to your healthcare provider if symptoms persist. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips from HeInfo. Got questions? Drop them in the comments below. See you in the next video.